alternative medicines and digital health.
Good afternoon, everybody, and thank you for joining us to this panel discussion. We've got a very important, yet sometimes controversial topic, not from the digital point of view, but from the therapies that fall under alternative medicine. So for this panel meeting, we've got Professor Sopardi and Dr. Selmi, who will be joining me for this venture. So before we start, I would like our panelists to introduce themselves, especially when it comes to the relationship to their work, their knowledge, okay, their experience with digital pharmacy, and also alternative medicines at large. Yeah.
So my name is Majda Selmi. I am doctor in health science and phytotherapy advisor. I work in the Faculty of Medicine of SUS in North Africa.
So I'm Liliana Sopardi, a pharmacist by training. My area is more into pharmacy practice, so how we get medicines optimization and how we manage patient care management with a broad outlook into using the innovations, so digital health, and I collaborate with my colleague Professor Attard to make sure that we help our patients use the scientific information related to herbal medicines and food products.
Okay. So before we delve into alternative medicine, I would like to ask the panel, what is their perception of the role of the pharmacist when it comes to digital health and the use of medicines, okay, conventional and also alternatives, even food supplements are becoming more important nowadays. So.
Okay. For me, I think it's important that the patient is in the middle center of all the conventional or non-conventional medicine. It's the objective here to find solution for the patient, to find solution for all disease, to find solution to stop suffer of patient. Even it's by technology or by anything, I think it's important to think like this.
So I believe that the fact that the pharmacist has historically been a go-to person for our patients. My grandfather was a pharmacist, and as a young child, I always was impressed with his community pharmacy being full of people from the village coming in to ask information from my grandfather as a pharmacist. And with time, when we had this more rapid technological development of medicines, maybe we thought that position of the pharmacist was slowly decreasing. In fact, that is not the case, because as patients became more complex, as medications became more complex, and as society became more empowered to look up information, they are more and more coming back to the first port of call, either the primary care physician, the GP, or pharmacists, mostly in the community practice, asking questions about information about disease. But nowadays, we're also getting questions about what they have read and seen on Dr. Google. And this is both for the conventional or the medicinal products, but also for the herbal products, food products. So the more information is out there for individuals, for society, the more accessible that is becoming, the more digital we're becoming, the more I see that pharmacists and healthcare professionals need to provide backup and sustain this involvement in the digitalization.
So as we all know, alternative medicine is sometimes controversial. as it is not aligned always with the pharmacological principles. Say, for example, homeopathy, right, going beyond herbal medicine, which of course there is some evidence that we can base our assumptions, our uses for these medicines. But of course, when we go beyond that, chiropractic, and other type of therapies. So we see that with medicines, with conventional medicines, sometimes it may be a little bit difficult even to digitize, okay, the approach for the patient. What about with these alternative medicines? Okay, what do you think that we can actually in the future hope for the implementation of the use of these alternative medicines alongside the conventional ones within this digital world?
I think it's important to give the right information into Google, like Google, because many of people ask Google about something. He have headache. He ask Google, what should I take, like herb or like another treatment to treat my disease or to treat my pain. And he asked Google about this. Then he used a protocol. It's not very safe. The problem here is the safety of use of plants, the safety of use of herb, the safety of the patient. So I think we have the objective here to reclaim or to say that you have to put the right protocol for the right herb or conventional medicine or non-conventional medicine, even the same. Because the safety of patient here it's the objective.
Yeah, I strongly reiterate what has already been shared by my colleague here on the platform, that our duty is to help patients navigate across the variety of products. Because even if we're looking at medicines or the herbal products, the individual out there needs the healthcare professional to guide on identifying what products are safe, those products that are of quality, and also when we go into the aspect of the alternative medicine and the herbal products, probably patients may have the myth or misconception, since they're herbal, they're safe. And on the digital information, that may also be transposed in the colloquial digital information. So as healthcare professional, that is part of educating that even when using those products, quality is going to be important, and effectiveness. And unfortunately, even as the scientific persons, there are a number of products for which we still do not know the explanation to their mode of action. So we still do not know the risks of, for example, interactions when they're taken with the conventional medicines. So probably it's an area where there's a lot of potential for scientific research, and as has been demonstrated by the speaker in the last keynote, and that it's our duty to convey to the patients that safety is important, and hence to rely on the reliable information.
In fact, I concur with you that education is very important, especially when patients are on chronic therapies. They're taking medications, conventional medicines, and they experiment with these herbals, with food supplements, and perhaps the pharmacist, the physician, is not aware that the patient is taking such medicines together. So how do you see the role of the pharmacist there as an educator, okay? Not just in terms of medication use, but also on the monitoring of their condition. Because some patients who are perhaps controlled for their diabetes, they come in the pharmacy and they tell you, I haven't got diabetes. It's being controlled. It's there, but it's being controlled. This is something that I think perhaps we can have an insight also from our panelists.
Yes, this was a very good point raised, because in fact a few years back we had a research study where we looked at what patients declare they are taking before they go into anesthesia. Patients are asked any medications you're on beyond their profile, and many would not, or any products you are taking, and many would not mention any of the food supplements, herbal products they are taking, when we know that some of them could have an impact on the effect of anesthesia when they have completed their surgical intervention. So yeah, it's something that needs to be considered when one is trying to get information from a patient. Now, of course, that is going to be quite tricky if it's a patient where there's no profile, and that's where digitalization comes useful, because you have the information in the digital profile, which the pharmacist can go to, update, and share with the rest of the team. It also depends on the relationship that the healthcare professional, the pharmacist, has with the patient. The more you know the patient, the more able you'll probably be to build up this information that the patient thinks is not useful. So here I think the key word is going to be the relationship.
So one other aspect is that apart from the healthcare professionals that we are actually aware of, we know within the modern therapies, we've got the doctors, physicians, we've got pharmacists, nurses, and perhaps others who are assisting physiotherapists and so on and so forth. But with alternative medicine, we've got also the practitioners. We call them the CAM practitioners, complementary and alternative medicine practitioners. So we have got here an added level which may complicate even matters. What is your experience, perhaps? Have you encountered such practitioners in your practice, in your studies, who are available to share information with the conventional healthcare professionals?
For me, I think the research, and the researchers, they are responsible for all information, for the evidence-based medicine. They are responsible to share the protocols of any new or innovative medication or treatment, even hormone, even it will be with non-conventional medicine or conventional medicine. We have to be clear with the people. We have to be clear and how to say it. We speak the same language, that they understand us, not like what we share, like scientific and something that people does not understand this. So I think the researcher, they have this responsibility to do.
As from the practice side and also from the educator side, we recognize that one of the biggest challenges in ensuring a patient-centric approach is maintaining an intercollaborative practice, a collaborative practice, which of course needs communication. And in fact, this is one of my challenges I see the more we digitalize. Because unfortunately, you see society, as we are digitalizing more, they're more into even how we communicate. Sometimes you have people in the same building communicating digitally. Over the phone or through an email, when you can actually go and speak to that person. So I believe that one of the biggest challenges, especially the more we digitalize, is that we need to keep communication at the forefront. It's still a challenge, even though we always dictate that healthcare professionals need to communicate. It's still something that we have to keep building on. And when we say healthcare professionals or professionals, it needs to be a really extended group. the patient, his immediate family, his carers, and also other practitioners who are involved. So if we're talking about what medications and health and food supplements and alternative medicines they use, that means that the communication has to also incorporate these people around the patient. Now, the fortunate thing about digitalization is that this very large group could communicate more easily. However, probably at this stage, many think it's easily said than done. So we need to all work towards that with having a vision of not creating barriers of who is close to the patient, including, therefore, these other practitioners.
In Germany in 2020, there was the regulation of the digital aspect of medical devices, that is the regulation of software, standardization of software, which is very important because if you're looking at blood pressure, at heart rate, you need equipment that needs to read the right sort of value for the patient so as to maintain the patient on the current therapy. So how you see this perspective when it comes to this combination of medications? Sometimes we know patients are sometimes on polypharmacy, so several medicines are being taken all at the same time, adding on supplements, also herbal medicines. So how do you see the importance of such devices to monitor the patient?
I think it's important to have such information to be clear about the protocol of taking every medicine or every treatment. The idea here is to know how to use the treatment, even by herbal or by any other medical. Also in phytotherapy or in herbal medicine, the first one that we learn is how we take medicine, or how we take herbal, even tea infusion, how we take this, the time, the quantity, what we should eat before and what we should eat after that. This is very, very important to share this information, and it's important to have something in the internet to have something to clarify such protocol or such protocol of uses of these medication.
Yes, coming to these devices, I think there are two aspects. They are out there. We cannot control what's out there and what our patients are using. At the same time, if they are accurate and robust, they are creating data, big data, because you have a lot of data about your patients, which we, healthcare professionals, can use to optimize therapy better. Like, for example, if you have a patient who's using a digital app monitoring his blood pressure, you might be able to detect that they don't have the early morning peak, but they are suffering from a dip in the afternoon. So that is when there you can help the patient to adjust the timing of their conventional or other therapy that they are using. So that big data could be useful for the healthcare team to adjust the treatment. At the same time, however, as you mentioned, out there's a wide plethora of apps and software, some of which may be robust enough, others may not be that robust enough. So that is the next step. How are we going to regulate? As I see it at the moment is that as the healthcare professionals, we can empower patients to be able to assimilate the quality and the safety of the app or the device, the software device they are using. So, and in fact, as educators, in the discussions for pharmaceutical educators, we are always saying you cannot teach your students, your graduates, the devices and the apps that are going to be available tomorrow. But what we are looking at in the education is providing them with the tools so that they can empower patients to make the right decisions on which app to use and how to interpret that data.
Yes, in fact, all this, when it comes to digital health and the complementary and alternative medicines, is the holistic approach. So the digital component will continue to implement more holistically the patient's needs. So there are several other aspects that we can discuss, but we are, of course, running out of time. There is the legal implications for these alternative medicines. Perhaps one last word before we close off with our panel discussion.
So, for me, it's important to have the information clearly and to have a network about this the herbal medicine, because it's something very dangerous if you don't know how to use it. It's not safe. We cannot say herbal medicine, it's safe. No, it's not safe. If you take herbal medicine by your own, you cannot, you can be poisoned, be poisoned. So it's clearly to have a good idea about herbal medicine and have a clearly idea about the protocols. Thank you.
Yeah, I think my take-home reflection in this specific area is going more for science in the herbal medicine use and connecting and communicating between the professionals and to our patients.
So I would like to thank you for this very interesting discussion, and for you who are here sort of hearing sort of this discussion. Thank you very much.